So, Dr. Navneet Singh, we would like to welcome you.
But yeah, I'm happy to be here and happy to address the youth in our community as well as their parents. Of course, we're in a complete unique situation right now, unprecedented times with the coronavirus, and it's causing broad impacts in terms of economy and in terms of health. So I wanted to, talk specifically to some of the teens that are listening in, because I know this is a really rough time for you guys. Everything from the way that you are learning, which I know for a lot of teens is moving towards online learning, and even online learning takes so many various platforms between Zoom meetings or Google Classroom or Google Meet. Some of the teens that are listening on are doing synchronous learning or asynchronous learning. The amount of hours that they're spending on online learning is really variable. Some schools are offering grades, some are doing pass-fail. So in terms of the academic portion of things, just, everything's been turned upside down, and, of course, that can create a lot of stress and anxiety. There's a lot of uncertainty that's happening right now because of all of that. So, academically, I know that the youth are going through a lot right now. In terms of social issues, this is a really tough time for youth as well. It's important for us to remember that during the teenage years, social relationships are really important. Peer relationships are very important. It's very normal for teenagers to worry and care more about what their friends think than what their parents think. And this is a really rough time in that regard too, because social distancing and shelter in place. I know that the teens are not able to meet their friends the way that they used to, and that can be a really tough thing to do, especially when a lot of teens do look for support from their friends when they're going through tough times like we're going through right now. And then the third thing is in terms of extracurriculars. I know a lot of the people that are listening in do a lot of things outside of academics, which we know is a really healthy thing to do. So it's really hard when you can't play the sport that you would like to, that you love to play, and you can't meet your teammates as you're playing sports, or if you're doing theater or drama, or community service, robotics, all the different things that youth are doing today, that's all been cut off. And so that's really tough too. So again, it's a really tough time that the youth are going through, so that's why I think it's important that we have platforms like this in which we can try to support our youth and help them as well as their parents navigate through this time. So as I talk about this, issues related to youth during this COVID-19 pandemic, just kind of overall, what I'd like to start off by doing is talking a little bit about the epidemiology of this virus, which of course we know is changing literally on an hour-to-hour basis. Talk a little bit about the science of this virus, and then move on to offering some tips to parents in case there are some parents listening as well, because, of course, as I said, this is a really tough time for kids, but it's a tough time for the parents as well, who are working from home and grappling with how to take care of their kids and trying to keep them on a routine and worried about how much they're on their technology. So I'll have some tips for parents, but then also some tips for all of the teens that are listening in terms of trying to get through this in a more healthy way. We're just gonna take a look at some information. So what is it that we're talking about? I just wanna kind of define that a little bit. So everyone talks about coronavirus. Well, let's keep in mind that coronavirus, there's many different types of coronavirus. In fact, coronavirus is one of the leading causes of the common cold. So it is important for us to just, define what this is. This is specifically SARS-CoV-2. That stands for Severe Acute Respiratory Syndrome. And then CoV is short for coronavirus 2. So some of the teens may not remember this, but at the beginning of the decade, it was our first SARS coronavirus, which started in Hong Kong. And then later on this decade, we had the MERS virus, Middle Eastern Respiratory Syndrome virus. And now we have this SARS-CoV-2. So, specifically, that's what we're talking about. So as I said, in terms of the epidemiology of this virus, and I put these numbers in as of yesterday. The numbers have changed even today. Of course, this is devastating. There's been over 1 million cases of people that have been confirmed to be infected with SARS-CoV-2 worldwide. It's a global pandemic affecting over 140 countries. And again, as of yesterday, almost 600,000 confirmed cases in the United States alone. Of course, this is making us have the dubious distinction of being the country that has the most number of infected people with SARS-CoV-2. And of course, the saddest part about this, right, is the fact that there's significant morbidity and mortality associated with this. Over 20,000 fatalities in the US alone due to SARS-CoV-2. Now, keep in mind that the mortality rate, which we think is 1 to 2%, is probably actually not that high. And the reason for that is because we don't know all the people that have actually been infected with this virus. The only people that we know that are infected are the ones that get tested. And there's a huge number of people that have this infection that have never been tested, partially because it's been really hard to get testing out. We've had very little testing available. So as healthcare providers, we're really trying to prioritize the people who really need the test the most. So again, there's magnitudes of people that are infected with this virus that we don't know about. And for that reason, again, the denominator changes, so the mortality rate's actually probably not as high. It might be a little bit closer to 0.7%. Now, this compares to influenza virus, which is causes much lower mortality rates. But again, that's kind of based on epidemiology and data, and our data about SARS-CoV-2 is not exact. But with influenza virus, the mortality rate's at 0.1%. Now, another point that I did want to make is that, as I mentioned, there's close to 24,000 fatalities from SARS-CoV-2. I just saw an article that came out today that indicated that the number of deaths due to influenza this year in the 2019 to 2020 cycle was 24,000. So 24,000 people died of influenza infection this past influenza season. And I'm not at all saying that influenza and SARS-CoV-2 are the same. We have a vaccine for influenza, which we do not for SARS-CoV-2. The transmissibility is probably different for SARS-CoV-2. The testing is much more robust and available for influenza. Again, I'm not saying these are the same viruses at all, but I do want to just remind all the listeners out there that influenza is a deadly virus, and just a plug for everybody to try to get the flu vaccine every year. So going on to the symptoms of SARS-CoV-2, and I think a lot of the audience is, I'm sure, familiar with this, but it's good to just review. Of course, the most common symptom that we tend to see is fever. This is a respiratory virus, so of course we tend to see cough. And then a smaller subset of people show shortness of breath and fatigue. Again, this is a novel virus. We're learning about it more and more every day. And so we're realizing now that some people do actually have GI symptoms, gastrointestinal symptoms. Loss of smell seems to be one of the other symptoms that some people have. So, again, we're learning more and more about the virus, but, fever and cough, shortness of breath are kind of the primary symptoms that we look for. Interestingly, again, this talk is kind of specifically related to kids and SARS-CoV-2. Kids, as I'll talk about later, tend to have milder infection or be asymptomatic when they get this infection. And interestingly, they do also tend to have lower rates of fever and cough as compared to adults. So again, just talking a little bit about disease severity, luckily the majority of people that get infected with SARS-CoV-2 have mild symptoms. So, of course, we think about the really sad cases of fatality, and those are there. That's affected thousands of people. But keep in mind that the majority of people that get this infection will have mild disease. A smaller subset, about 15%, will have severe disease, and then a small, about 5% of people will actually be sick enough to get hospitalized. Now, the people that get hospitalized are generally people that have other risk factors. We know that this tends to be a virus that causes more serious infection in the elderly, especially in those that are over 65 years old, or in people that have what's called pre-existing medical conditions, including hypertension, just a fancy medical word for high blood pressure, COPD, which stands for chronic obstructive pulmonary disease, or diabetes, or people that are immunocompromised, such as people who have gone through chemotherapy or are on some drugs for autoimmune diseases. Why is it that kids seem to not get as significantly affected with this virus? We're not exactly sure. Scientists are exploring several theories about why children seem to be relatively protected from getting severe disease from SARS-CoV-2. And one of the leading ideas is that there's a receptor in human cells that the viral particles attach to It's called the ACE2 receptor, and it seems like this may not be as prominently expressed in young children, or it may be a different shape. So, again, we're learning more about this virus, but perhaps that's the reason that this virus doesn't tend to affect, kids as often as it does adults. Another thought actually is that the kids in general, their immune system doesn't respond as aggressively necessarily to viral infections as an adult immune system, because the kid's immune system is not as robust, and it's possible that for that reason, maybe the virus just doesn't get a chance to replicate and cause as much damage. Interestingly, we know that about 28% of cases of kids who get a coronavirus infection, as we're getting more and more data on this, are actually asymptomatic. And that's a really important point that I'd like to make to all the youth that are listening to this right now, is that that's considered to be one of the reasons that this virus is different than other coronaviruses, such as the first SARS virus or the MERS virus, in terms of why is this virus so much harder to contain. And part of the reason for that, the thinking is that kids are oftentimes asymptomatic and may not know that they have the infection, and then are passing it to other people. So shout out to all the teens that are listening to please practice social distancing. Even though we know that kids don't tend to get significantly ill from this infection as their adult counterparts, they're more likely to be asymptomatic and pass on the infection. So again, please practice that social distancing. But again, the numbers look much better for kids. We know that less than 1% of patients who have been hospitalized are under 19 years of age. Now, if you look specifically at the kids that have been hospitalized, it's usually the babies. So kids under 1 year of age are the ones that are more likely to get hospitalized, especially if they have, again, pre-existing medical conditions, such as being born premature or lung conditions or things like that. Another issue, of course, related to pediatrics is newborn babies. So again, we're learning more and more about this virus, but from what we know so far, it seems that vertical transmission from mom to baby is not thought to happen. Cases of kids so far who were born to moms who were tested positive for COVID-19 do not necessarily get the infection. And it is also not thought to be passed through breast milk. So the current recommendation is that if a baby is born to a mother who is tested positive for COVID-19, they should be physically separated from them so that the child does not get infected, but the mom can continue to pump and give breast milk to the baby. So again, I wanted to talk a little bit about some tips, completely shifting gears now, just to the parents that are listening about what they can do at home. Again, these are kind of very different times. We have a different reality that we're living in right now. So what is it that parents can do at home? And this is geared a little bit more towards parents that have like the little ones at home to try to just keep the home calm. So one of the things is to try to prevent boredom. We know that bored or frustrated kids are more likely to act out. We know that kids have had their lives significantly disrupted. They're out of school, they can't play with their friends. So it is important to try to keep kids busy, with a healthy and productive schedule. Number two is address fears. These are scary times that we're going through right now. Again, lots of things that can cause a lot of anxiety. Kids might see their parents nervous and worried. Of course, they're seeing news reports, they're hearing about people dying. So it's important to talk through these things with your kids, have discussions about them, find out what their fears are, what their thoughts are, maybe dispel some myths that they have or uncertainties that they have. Number three is using timeouts. And again, this is obviously not for our teens, but for our younger kids. And the important thing with timeouts that I always tell parents in clinic is that this is not really something that you want to do necessarily in a punitive way, but it's more just that if a child is having a behavior that is not the right behavior, that they need to get a timeout from the behavior and the parent needs to get a timeout from them. So it's more just about putting a child into an area where they can't hurt themselves or hurt you, letting them vent, and then afterwards, that's a time just to kind of talk about why you needed to put them in the timeout. Kind of related to that is to redirect bad behavior. Sometimes kids just misbehave because they don't know any better. And, when things like that happen, things like distraction and just trying to kind of like get them onto something else is a good thing to do. Sometimes it's good just to not respond. If a child is doing something and it's not really going to end up hurting them or hurting other people, ignoring bad behavior can be an effective way of stopping it. So it's just another tool that parents can have available to them. At the same time, we want to praise success. That's what we call positive discipline. It's a really important aspect of parenting. all too often as parents, we're calling out our kids when they're doing something that we don't want them to do, but it's important to praise them when they are doing things that are helpful. Allowing time for attention. This is a tough one because parents are at home now and they're working from home, and sometimes kids are looking for our attention. We may not be able to give it to them, but even carving out just a few minutes every day to try to give some attention to kids is great. And of course, I hope this goes without saying, but you really want to try to avoid any kind of physical punishment. We know from lots and lots of data and research that it's not effective, and you're not role modeling good behavior if you do that kind of stuff. If you are aggressive to your child, you're basically validating aggression for them. And then lastly, take care of yourself. This is kind of like the oxygen mask on the airplane thing. You got to breathe before you can help your kid breathe. So just to make sure that, you are taking care of yourself and staying in a healthy place so you can be effective. So I want to talk now specifically to all the teens that are out there listening about what is it that you can do to kind of navigate through this tough time. I'd say probably one of the most important things that if you can is to stick to a schedule. It's really hard right now because, again, everything's topsy-turvy. You're not, waking up in the morning, getting ready, going to school, doing your extracurriculars, coming home, having dinner, studying. Everything is just, all different. So if you can, though, continue to try to stick to a schedule that works with your online learning. So set a specific time to wake up. Try to make sure you have some time to exercise every day. Take your shower, get dressed just like you would if you were going to school. Eat your breakfast. So just really try to keep a routine. If it helps, do allow yourself to sleep in a little later than you normally would. This is a good opportunity for that. But otherwise try to stick to a routine. And just like you would if you were in school, try to keep your phone off while you're doing your homework. Try to keep the TV off during school hours. And just plan mini breaks. Make sure you give yourself time for lunch. But I think having a routine is one of the most important things. The second thing I want to say is just about dinner. I think one of the times of day that I always really look forward to is coming home and having family meal time so I can check in with my wife and 2 kids and see how everything's going. So I think, it is a good opportunity now that parents are working at home and that kids are not necessarily busy doing extracurriculars to actually have meal times together. I think it's a really important way to support ourselves through all this. The next thing is allowing yourself for some downtime. So it is really normal for teenagers to crave privacy from their parents. That's a normal developmental thing that we see happening during the teenage years. So I'd say to the teenagers out there, give yourself some time for some quiet time, some reflective time, some creative time. Listen to music. And I do think to parents, it's really important to allow our kids the time to have the abilities, the time to connect with their friends. Again, social relationships are really important for kids, and it's important for them to be able to continue to have those connections to support them to get through this. The next thing is just share information about what's happening, especially for the teens who are really savvy, smart. We're all getting a lot of information every day about coronavirus, but I think it's important to just talk about it. What is the data showing, and what are the newest results, and what are we learning about this virus, because I think it's always important to be educated and informed. As I said before, would really encourage the teens out there, the youth, to remember that social distancing is really important. The elderly are really at risk right now, so one of the best things we can do to keep parents, grandparents, all the elderly safe and hopefully out of the hospital is to practice that social distancing. And then, as I said, reach out virtually. As I mentioned, it's important to kind of keep those social connections going. So I have a teenage daughter at home myself. She's 16 years old, and I have an 11-year-old daughter. So we've talked about how this is a really rough time. But at the same time, I think there's some opportunities that are available. There is definitely more downtime right now. So I think it's a good chance to just kind of try to develop a healthy body and healthy mind. So one of the things that my 2 kids have been really great about doing is really helping out with some household chores. And, I think that all too often we're so focused on academics, but there's a lot of really important life skills, or what I call kind of adulting skills, that I think that the youth have an opportunity to really get a chance to finally learn. Maybe this would be a good time for you to learn how to cook some simple meals so that when you go off to college, if you're staying in an apartment and not in a dorm, you can actually do some cooking for yourself. Maybe this is a good time to actually learn how to do laundry, which you're going to have to do when you head off to college, or learn how to put the fitted sheets on your bed, and all that kind of stuff. So just helping out with household chores. And I think one of the things that's important with that is it's important, I feel as a father, for everyone in a family to realize that this is a tough time and it's really important for us to support each other and to feel like as a family that you are working together to get through this. And I think helping out with household chores is an important part of that. Another thing that I would really encourage all the teens out there to do is to exercise. Lots of research has shown that exercise is a way to make not only your body feel good, but also your mind feel good. You're releasing endorphins when you exercise. So, really encourage the teens to try to find some time to exercise every day. Again, with social distancing, I know you can't get out there on the basketball court or soccer field, but there's a lot of online things that you can find to do at home. And, of course, going for a walk in the neighborhood, as long as you are practicing social distancing, it's great to do. Kind of related to exercises, meditation and yoga. So, again, we're learning more and more about all the benefits of things like meditation. So, maybe this is an opportunity to actually pick up a meditation practice. I think it's really important, especially in situations like this, where there is a lot of potential for stress and anxiety and confusion, to be able to find some time to do some meditation or to develop a meditation practice. I know when I see teenagers in my clinic, I refer them to some really great apps that are available to learn meditation. So one is called Headspace, one is called Calm, so you can check those out. And the great thing about an app is that you can do it on your own time, whenever you want it, wherever you want it. A lot of those apps have even like a 5-minute meditation that you can do. So good chance to learn that kind of stuff, make it part of your daily routine, hopefully, even if it's a few minutes. And then again, a lot of research is showing that the benefits of yoga, it's really great, of course, in terms of flexibility and spinal alignment, but it is actually a really good way to just de-stress. It does help in terms of anxiety. So again, lots of great online opportunities for things like yoga. I know a lot of the teens that I see in my clinic are so busy with schoolwork and extracurriculars that they don't really get a time to explore other things, but maybe this is a good time to pick up a new hobby. If there's something that you've been kind of thinking about doing, but have never really gotten a chance to do it, maybe this is a great time to do that. Or on the other hand, there's something that you've been really into and just never have time to really kind of dive deep and learn more, whether it's, doing some stuff online or watching documentaries or things like that. This would be a great opportunity. I know a lot of the teens that I see in my clinic are sleep deprived. They're not getting enough sleep. They're busy doing homework and extracurriculars and, trying to get those good grades, trying to get into a good college, and sleep gets sacrificed. But this is an opportunity, I think, to really try to make sure that you get a good amount of sleep. We recommend that, teenagers get hopefully 8 to 9 hours of sleep per night. And one of the things I really emphasize when I see teens in clinic is it's not just the number of hours of sleep that you're getting, but the quality of sleep that you're getting that's important. And the quality of sleep is directly tied into when you go to sleep, because more of your deep sleep cycles occur earlier in the night. So if you go to sleep too late, even if you're sleeping for 9 or 10 hours, let's say you sleep at 1 o'clock in the morning, you're just not getting as much of that good, deep, rich sleep. So try to get to sleep on time, hopefully not later than about 10:30 or 11 or so. Try to get good 8 to 9 hours of sleep. And then lastly, this is a good opportunity. I know I've been doing a lot of this myself, is just to go through stuff, go through your closets, go through your drawers, find out, what you really need, what you don't need, get your desk, really kind of nice and organized, and a great opportunity to maybe realize that there's some things that you have that you don't need, and we can donate those things to people that are less fortunate. So in closing, I would just say this is a great opportunity to practice gratitude. We know from a lot of research that people that practice gratitude are happier, and the people around them are happier. So, maybe a good opportunity to keep a gratitude journal on your bedside. So, again, research has shown that if every night before you go to sleep, you write down 3, 4, or 5 things that you're grateful for, and you do that on a regular basis, that really does help in terms of your overall happiness. But, these are uncertain times. I would say at this point, if you're lucky enough to have food, and if you're lucky enough to have shelter, and you're living and breathing, I think really more than academic success, that's what defines success right now.
That was wonderful. I love the way you you turned around all the problem times into a personal growth opportunity for the kids. I loved about the positive disciplining, redirecting the bad behavior. Your suggestion of using apps, I myself have the app Calm, and my little one loves the stories on it, and the stories are so beautifully, orchestrated on that app that I would definitely love for the audience to try it. Thank you so much.
Of course, yeah.
We'll really encourage everybody to make the best of this opportunity and come up and have your questions. Dr. Navneet, while everybody's typing in, would you talked about the quality of sleep, but I think a lot of teenagers would agree that even if they would want to sleep at a certain time to make the best out of it, the schoolwork is so enormous that they usually just cannot go to bed at a certain time. So they usually get.
They're also very demanding and quite stressful. And I think a lot of the kids that I see are high achieving, which is great. But you're absolutely right. It's hard by the time that you finish school, do your extracurriculars, come home, eat dinner, and if you want to do well in your coursework, just staying up late. I see a lot of kids who are sleep deprived, exactly as you said. Again, I think the online learning that's happening right now is really variable from school to school. I think in a lot of cases, the amount of online learning may not be as much as what kids would normally go through in a regular school day. So, personal example, I know my older daughter who's a junior this year, she has a maximum of 3 hours of online learning per day. And again, I'm not saying that all kids are like that, but I do think it does open up time for at least most kids, I think these days, to hopefully have some open time, and hopefully if they have more time to be able to get their homework done, that will then allow them to sleep on time. But it just goes back to my important point about routine, because I think what's very easy to slip into is almost like a vacation mode where you're sleeping late, waking up late. So we know that's not healthy. So I think it's important to, again, use this as an opportunity to try to get to sleep on time. Allow yourself to sleep in a little bit, just like we do on weekends, but it should ideally be no more than about 45 minutes to an hour later than what you would normally wake up at.
All right. And we're looking at about 7 to 8 hours for teenagers.
I'd say ideally 8 to 9 hours, but yeah, we'll take 7 to 8.
8 to 9. Okay. And how about the younger ones, the elementary kids?
Yeah, so for elementary kids, again, so much science that we're finding out in terms of the importance of sleep. So sleep is when what's a lot of called consolidation of learning is thought to happen. All those things that kids are absorbing during the day, those synapses are firing, things are getting consolidated. So really important, for all that development that kids are going through, for them to get, again, a good amount of sleep, a good quality of sleep. So I'd say for the younger kids, if they could get like 10 to 11 hours, that'd be great.
Right. And Dr. Navneet, there's a question about whether if you should be in contact with pets if you are likely to have COVID-19. Are we advised to stay away from our pets during that time?
So the question is, if someone is infected, if they're a confirmed infected case, should they stay away from their pets?
Mm-hmm.
Yeah. So again, this is a lot of what we're learning about this virus is emerging, because this is, again, a novel virus, and we're getting more and more epidemiologic data, longitudinal data. I do remember reading about a case of a tiger that was infected with COVID-19. The zoo caretaker had it, and the tiger tested positive as well. From what I recall reading, the tiger was asymptomatic, so maybe pets are like kids, and they tend to have higher rates of either asymptomatic or mild disease. So that's a good question. I have a dog at home that I love dearly, and I'd want to make sure that he stays healthy. But yeah, I think at this point I would say it's fine to be around your pets.
Okay, so we do have another clarifying question for you, Dr. Navneet. I'll read out the question for you. Does the transfer of COVID-19, it's regarding that. I know a lot of my friends are really paranoid, in particular about touching doorknobs, etc., and then touching their friends. I'm really cautious of that as well, but obviously it can be very anxiety inducing to be hyper aware of these circumstances. I wanted to confirm that the transfer is only successful if the virus reaches your respiratory tract system?
Yeah, that's an excellent question. So, there were articles that came out. There was, I believe, a New England Journal article about where they talked about how long this virus lasts on different surfaces. And I think that did create a lot of anxiety for a lot of people, myself included. Where they talked about how it lasts on plastic and cardboard and metal. And, you get to a point where you just kind of feel like you can't touch anything and you're washing your hands every seconds. I think the important point to make with that is that first of all, we know that this is passed through respiratory droplets. So just to kind of talk a little bit more about that, some viruses are passed airborne. So example is measles virus. So if someone came into the waiting room in my clinic and had measles, they were breathing it. It's going to linger in the air for several hours, maybe a few days. But with this virus, we know it passes from respiratory droplets, which means it comes out and then the heavier particles fall down. The lighter particles may stay in the air for a period of time. Primarily the risk of infection is if someone who is actively infected or asymptomatic, but basically has an infection, is within 6 feet of you and coughs or sneezes, and that's the main way that you can get sick. The other way that you can get sick is if you touch something that has the virus on it and then also happen to touch your face. But it's important to keep in mind that we all touch our face way more than we realize. A lot of us touch our face without realizing it. We're right in the middle of allergy season right now, and a lot of people have itchy eyes or itchy noses. We know that sometimes people bite their nails. Younger kids suck their thumbs. So all of those things, can lead to transmission of the virus. But again, it's important to kind of realize that just because you touch something that, let's say 3 days ago had a virus, on it and it still has some of the virus, it doesn't necessarily mean that you're going to get infected, because it's important to understand that there's things like viral load and, viral half-lives. So just because you touch the virus and it's on your skin does not mean that necessarily the virus is of a significant enough burden to actually lead to infection for you. So again, I think the most important thing is just going back to what we've all been hearing time and time again, which is lots and lots of hand washing, especially if you have touched things like, doorknobs that friends have touched, or, you're picking up packages that got delivered. You've gone to the grocery store, obviously, anything where you've touched things that you might have contaminated your fingers, and then, because again, who knows if you'll accidentally touch your face. Make sure that you wash your hands and make sure that you try to avoid touching your face.
I think it answers the question, because there was another question which said that, they wanted to confirm if we do touch a doorknob, wash our hands, and then go to touch those who are quarantined with, will they be okay? So I think you just answered that question about how frequently is it required to wash our hands.
Yeah, so if you are in a household with someone who's been tested positive for COVID-19 and is quarantined in the house, hopefully they're in their own bedroom and using their own bathroom. Of course, you're not sharing food, and they have their own towels and all that kind of stuff. Obviously in a situation like that, physical isolation to the degree that's practical, but also being like extra vigilant, I'd say, about hygiene.
And Dr. Navneet, there's a question regarding if the kids have mild fever or runny nose or just throat infections, and the parents are not too concerned about COVID-19 for them, but should they be avoiding the hospitals at this point?
Yeah, that's an excellent question. So we as a pediatrician, I get phone calls, emails every day from parents whose kids have mild symptoms of being sick, and they're not sure if they should get tested, if they should come into clinic. I'd say at this point, in general, we're recommending to try to avoid clinic visits if possible, just because of social distancing and shelter in place. And when you go to clinic, there's always a chance of getting exposed. And in terms of getting testing done for a situation like that, as a doctor, one of the things I always think about is when I order a test, is it going to change my management for my patient? So, I think from an epidemiologic standpoint, I can certainly understand that, the more tests that we had done, the better that we would understand this virus and therefore be able to contain it. But from a management standpoint, if a child has fever and runny nose and cough, but they don't have any shortness of breath or difficulty breathing or lethargy, it really doesn't necessarily make sense for them to get tested because it's not going to change what we do. Other than the fact that, we'd recommend that they stay at home and be quarantined, but with shelter in place, we're kind of recommending that anyways. So I think the bottom line is, if your child has mild symptoms, I do not think that they need to come into the clinic. I'd look out for, the normal things that we look out for any viral infection, including influenza, which is cough that leads to heavy breathing, fast breathing. If your child is lethargic, if they're not urinating very well and dehydrated, if they have a fever that goes on for more than 5 days, because with any virus, usually the fever should get better within 3 to 4 days, maybe about 5 days. So I'd say those would be some of the indications.
And there is Hari from Jaipur, and he wants to know if there are any things he needs to do to avoid fear among his kids.
Yeah, that's an excellent question. So I think it's really important to just make sure that we get a chance to talk about these things with the kids. And, I think one of the most important points that I can make in terms of parenting is validation. I think it's really important for kids to understand that they have feelings like adults do and that those feelings matter. So before we try to, I think, educate our kids about this virus, just acknowledge their feelings, say, hey, I know that this can be really scary, or, you look like you're worried, or you look like you're nervous, or, that kind of verbiage where you just let them know it's okay to have these feelings and you understand that they have feelings. And then from that point, try to guide them through that. And, I'd say, especially for the older kids, it's important to do a lot of open-ended questions instead of just instructing them. So, once you've validated the feelings, say, tell me a little bit more, or what are some things that you've heard that are scary, or what are some of the things that make you nervous? Do you worry that, your mom and I are going to get sick, or your grandparents are going to get sick? What are your thoughts about that? What have you heard from other kids? How do you feel about the fact that you can't see your friends? For seniors, how do you feel about the fact that you can't go to prom, you can't go to graduation, you can't go visit these colleges? I think it's important for us just to touch base with our kids. So validate, and then be inquisitive, be curious, try to draw out their concerns.
Right. Dr. Navneet, there's another question. It's apart from social distancing, should we as a family take any supplements for prevention, specifically for COVID-19?
Yeah, so I think, this is definitely a good time to practice good, healthy habits in terms of, how we eat and exercise and sleep well, because those things in general are just going to optimize our body, especially during a time like this where there's a really, significant virus that's there. So Ankita, you know all about the importance of nutrition and how it really helps boost our immune system. Again, I'm going to harp back to sleep. I think sleep is a really important way that we can keep our bodies functioning in an optimal function. And then, again, exercise. So great opportunity to really emphasize those things. I don't think there's any quote unquote supplements that you need to take per se. I would just try to eat, as you know, Ankita, it's good to get these things from natural sources. I'd love to get your take on the nutritional aspect, but I always tell families, our bodies are meant to get the vitamin C and the zinc and the vitamin D from natural sources. That's how, we're designed. But if for some reason you feel like you're not getting those from natural sources, certainly taking a supplement. But I would love to get your take on that too as well, Ankita.
Oh, definitely, Dr. Navneet. I think I would die, it's just everybody, the shelves in the supermarkets are full of all these supplements, and everybody's all the time debating which brand to buy, and you have to check the labels, how much sugar is added, what are the different preservatives added to those. And like you said, if we stick to natural whole foods, our bodies absorb them better, and we reap the benefits for years together instead of just popping a supplement, and having vitamin C, which helps your body absorb iron. So we want to keep in mind that we're eating the right kind of food, we're eating vegetables and fruits, and that's complementing the body throughout.
Awesome. Yeah, that's a great answer.
Right. Dr. Navneet, there's another one which is very close to my heart. This question is it okay to bring a new pet in the house in the current situation?
For sure. Again, I'm going to be very transparent and say I'm biased in my answer because, again, I have a dog that I love dearly. And, again, there's real medical research that shows that having a pet actually decreases blood pressure, decreases stress and anxiety, decreases the rates of depression. It's been shown to prolong your life. So I know I've been especially grateful to have my dog during this period of time. Again, it's I think great that people are thinking about bringing a pet in the home at this time and causing them any potential harm. But again, I think at this point there's so many benefits, and I think it is honestly a good opportunity to have a pet in terms of the fact that everybody's at home and you can really work on that house training. So maybe a good opportunity.
Right, right. Yeah, I would completely agree. And Dr. Navneet, there's another question. How can we minimize screen time or phone time for teens? They need friends to talk, but it means more screen, more phone time, other than that they're all the time either studying or chatting or texting.
Yeah, yeah. So again, I'll speak not only as a pediatrician, but as a father. Again, I have a 16-year-old and an 11-year-old at home, and this is something that we grapple with on nearly a daily basis. So one of the points that I'd make is to the person asking the question, you are not alone. This is something that I think parents are really trying to navigate, and I think the reason for that is that when we grew up, we didn't have to go through this. I know when I was growing up, I either watched TV or did homework. So my parents didn't have to kind of figure out all this other stuff. But, I do think as a pediatrician, it's important to view these things through the lens of the child. And one of the things I think we need to remember as parents is that teens have way more options to be distracted than we did growing up. So, again, I had my TV, my teenagers have their phone, they have their tablet, they have their computer, they have their video games, they have Netflix, they have YouTube, they have, Snapchat. Right. Instagram. So, I think it's important for us to kind of just empathize, with the fact that this is really tough for kids too. And, it's important for us to remember that media technology is made to be enticing. All these companies want you to use their product. And so it's tough. We know from research that's been done that when you start using technology, you lose track of time. So, sometimes we get frustrated with our kids because they've been on their device for so long, but they don't know they've been on their device for that long. So, again, I think just see things through their eyes, realize it's a tough time for a lot of parents, but also for them as well. The other thing that I would say is that I think it is important to be a little bit more flexible at this time, just because they are at home more. And again, I want to just get back to the fact that social relationships are very important for our teens. And I think it's important for them to feel like they can stay connected. But all of that being said, at the same time, I think it's important to make sure that there's balance. So one of the things that we've tried to do with both of our kids is to say, can you please tell us every day when you're going to exercise, when you're going to shower, when you're going to have some time to do some reading? Can you please tell us what time you're going to try to go to bed? So that there's at least that expectation that, those things will happen. And, again, I think if you start asking your child to help out in the house, so if they're doing some of the laundry, if they're doing some of the cooking, if they're, taking out the trash, I know this last weekend in our family, that was when we did our kind of deep clean in the house because our cleaners aren't coming anymore. So it's the first time that my kids actually had to clean their bathroom and, that kind of stuff. So I think if you try to make sure, I think oftentimes we're focused on making sure that our kids aren't doing things like technology, but if you carve out time for things that you would like them to be doing, like exercise and like household chores, I think that will help. And then the other thing that I'd say is, again, and I know this is not easy, but get into dialogue with your kids instead of just saying, you shouldn't do this and I don't want you to do that and why are you doing this? Get into a conversation because I think youth, and I know there's a lot of youth that are listening, I hope that they will, agree with me. Youth, I think, appreciate when their perspectives matter and when their voice is heard and when they feel like they are part of the process and when they feel like parents are collaborating with them rather than kind of a top-down approach. So, some of the dialogue we have with our kids is, well, what do you think is an appropriate amount of time to be on technology and why do you think that's appropriate? And what do you think are some of the ramifications of using too much technology? But also, what do you enjoy about technology? What are some of the things that you're looking at? Show interest in that. Tell me this game that you're really into playing right now. But another thing that I'd say is, role model the behavior that you want to see in your kids. I think it's important for us as parents, if we are going to try to teach our kids to be disciplined in terms of the use of technology, you got to walk the line. You know, I think you have to show them that you have the discipline too. So, you know, show them that there's periods of time where you put down your phone. Family time, you know, really should be a time where nobody's on their devices. You know, if your kid comes up to you and is talking to you, if you can, put down your device, you know, give them the attention they're looking for. I think it's important for us to role model the behavior we want to see in our kids.
Perfect, Dr. Navneet. I loved your answer because you're emphasizing to have a schedule and not to worry too much that why they're doing it, but just find a very healthy way to tell them, oh, there are other things to be done. And instead of, you know, telling them why they shouldn't be doing something, just help them do something more constructive, which will take them away from the screen. Perfect.
Yeah.
Dr. Navneet, there's another question about the healthcare side of things. The question is wondering how those that are low income or less privileged are being taken care of or considered from a healthcare perspective?
Yeah, that's an excellent question. You know, I think in this country where, you know, unfortunately we don't necessarily have universal health care, it's really important to kind of think about the people that are more marginalized. You know, my 11-year-old daughter, I was so impressed the other day, we were walking the dog and she said, what's going to happen to all the homeless people? I was like, wow. You know, that's totally true. You know, they have no way of doing social distancing. They don't have hand sanitizers necessarily. You know, they can't wash their hands. So it's important for us to think about like other people in our society. So I applaud whoever asked that question. You know, I will say that here in Santa Clara County, we have a county hospital, and I rotated through the Valley Medical Center when I did my residency training at Stanford. And, you know, at that clinic, nobody was turned away. So if you had health insurance or not, if you were a citizen or not, you know, everybody got care, whether it was being seen in the ER or even just families that came in with their babies for well child visits. So the bottom line is, I think at the local county hospitals, everyone should be able to have access to medical care.
The same lady has another question which says, what sort of vaccines are we working on creating? She says that she has read a couple of things suggesting that people are considering creating a universal flu vaccine. Is the vaccine we are working on for COVID-19 geared towards this infection in particular, or the general flu?
Yeah, that's another excellent question. I can't say I have an exact answer to that. You know, I will say that vaccine development is, you know, well underway. I think the pace at which research is being done on SARS-CoV-2 is very, very fast. There's multiple centers in multiple countries that are working on this vaccine. You know, I think a lot of what I've read has said that the two main things that are really going to help us to control this pandemic are testing. So we really have a sense of who's infected and, you know, the epidemiology of this virus, and vaccine. I think those are like, you know, two of the primary things for containment. In terms of the vaccine itself, I don't know, honestly, if, you know, the vaccine is kind of like a flu-like vaccine. You know, this is a different virus than influenza virus, although, as I said at the very beginning, they both, you know, can cause a lot of morbidity and mortality. But I'm not honestly aware if the vaccine is, you know, kind of prototyped to be similar to the flu vaccine, other than the fact that, you know, it is something that I think would be recommended to be given on a widespread basis.
And Dr. Navneet, there's another question. Is it okay to wear a homemade mask?
Yeah, so again, we're, I think, learning more and more about this virus as we have more data on it. You know, of course, as many people know, initially, when people were thinking about wearing masks, whether it's a cloth mask or a surgical mask, the recommendation from the CDC was it's not necessary because it's not really going to help you from getting infected. But I think one of the things that we're realizing more and more is, again, in terms of transmission, is people that are asymptomatic who are spreading this infection. And wearing a mask, if you're asymptomatic, is you know, a good way to try to prevent other people from getting infected. So that's just in terms of masks in general. So I think, you know, if one of the primary reasons for wearing a mask is to not spread the infection, then I think a cloth mask would be just fine.
Perfect. Thank you so much, Dr. Navneet. I think those are all the questions that we had.
Yeah.
And thank you so much for all your time.
Of course, my pleasure.
Thank you.
So there's some interesting studies that are being done in terms of the BCG vaccine and how it seems like there may be some protective effect, not necessarily from getting the infection, It seems like the fatality rate seems to be lower for people that have had the BCG vaccine. We don't really know why. But you know, a lot of us that were born in India, or those of us who have parents that are from India, you know, it's just kind of interesting to think about the fact that BCG may be protective in some way.
Right. Dr. Singh, there's another question. Can we go out for walks or on hikes? And do we need to wear a mask, even if we, you know, if you're alone on a hike or don't have too many people walking around in our neighborhood?
Yeah, you know, honestly, I think it's super hard to just sit inside your house all day and, you know, stare at the same four walls. I do think that social distancing is, you know, very important. Again, especially to all the teens that are listening, you know, please practice that. I know it's tough, but I would say going for walks is fine. And, you know, again, we've been going on family walks with our dog and just enjoying the weather's beautiful day here. So yeah, no, I think going on walks, of course, if you can, try to maintain at least that 6 feet of, you know, social distancing. So I know when I'm walking down the sidewalk, if I see someone coming towards me, I just kind of move towards the middle of the street and vice versa. Right. So yeah, I think as long as you do those kinds of things, you know, hiking, I think quite a few of the parks are actually starting to close now. My family wanted to go on a hike this past weekend and it just wasn't available. So, you know, I think we just are going to the park or just the kind of local residential area. But in terms of wearing a mask, yeah, I mean, I think there's no harm in wearing a mask. There's only potential benefit. And, you know, again, if there's any chance that you are an asymptomatic carrier, no harm in wearing a mask.
Right. There is another thank you message for you. They say, thank you for the informative session and connecting teens and motivating them to handle the current situation. Big thanks on behalf of the MSMT team and the youth team from Navdeep Chehil.
Absolutely. Thank you so much.
Dr. Navneet, I have a question for you.
Yeah. Okay.
I was wondering, should the kids have their gadgets on charging in their rooms while sleeping, or should we practice all the kids, you know, putting the gadgets outside? Because I face that trouble myself, where my daughter argues that, oh, she's not going to pick up the phone or she's not going to look at the messages, but I just want to encourage her to, you know, leave her gadgets outside, but on charging in the night.
Yeah, that's a tough one. You know, if you figure it out, let me know, because both of my kids keep their gadgets in their room. No, but I mean, right. I've told them, and you know, again, this is just going back to research, right? It's not just you know, hand waving. We know that it's not healthy to keep gadgets in the room because you know, again, these are tempting little things. So it's very tempting to want to look at your phone, you know, before you go to sleep, and we know from research that activates your brain. It makes it harder for you to go to sleep. So yeah, I think it's not a good idea. You know, it also makes it too tempting to just start off your day first thing looking at your phone. So yes, ideally, you know, you should not be keeping those in your room at night. What I would say is if you as a parent ask your child to do that, you should do the same, because it's not good for, you know, adults to do that either.
Right. That's going to be a challenge for my husband. So
yeah. So I mean,
very easy.
Because I think it's just too easy for the kids to come back and say, well, why do you, you know, practice something differently than what you're espousing? So.
Mm-hmm. Dr. Navneet, thank you so much for all the wonderful information. I think everybody really, really appreciated your time here with us tonight. Thank you so much.
And thank you so much for moderating it.